I am Dr Saroja Koppala, infertility specialist and clinical director, Nova IVF Kukatpalli branch. Failed IVF, but why? Know everything. Why am I talking about this? In everyday practice, we see many patients who conceive with IVF, but there are few couples, in spite of repeated IVFs, they are not able to conceive. So it becomes totally frustrating, not only for the couple, but for everybody involved in the treatment. But so we have to make and deal with every steps that help us to improve the success rate. So sometimes we look at the embryo. The embryo might look morphologically, look-wise normal, but genetically it can be abnormal. So how can we identify it? We can do a test called pre-implantation genetic testing and to check whether the embryo is chromosomally normal or abnormal. And coming into the semen analysis. So semen analysis, when we look at it, we look and see how are we going to select the best sperm out of the million sperm in front of us. So the basic semen analysis, semen preparation methods are there. In addition to that, advanced techniques like PIXI, MAX, microfluidics. Sometimes we take the testicular sperm and that can help us to choose the best sperm from what the sperm is available. And uterine cavity, we should never ignore it because there are many things that can cause repeated implantation failure if you neglect the uterine aspects as well. So things like submucosal fibroids, polyps, adhesions like scarring from previous infections also can lead to decreased success rates. And how are we going to improve that? Hysteroscopy is a very good technique where we do have a look inside the cavity, and if there is any problem in that, we can correct it at the same time. And then we have to identify whether the embryo and the uterus is in sync. Sometimes called as, it's always called as window of implantation. We have to choose the right window to transfer the embryos. And there are some tests called as endometrial reception tests that help us to identify that. And sometimes we all neglect the lifestyle factors like the diet, the weight, stress, sleep, all these are very, very important. So have a balanced diet, control your stress level. There are many techniques and we have to learn to live with the stress. That is very important. Sleep, don't neglect at all, and all of us should be aiming to achieve a good BMI, not too over high BMI or low BMI. And in sometimes we use techniques like immunological testing whenever there is a particular need for it, and we do karyotyping or antiphospholipid antibody syndrome in special cases. And always we should think, if you repeat the same IVF cycle again and again, we are going to fail. So we have to take a personalized approach, right from choosing the right treatment, right medication, duration of treatment, what trigger, and the length of the luteal phase support, whether we need to do a fresh cycle, frozen cycle, what is important for this couple is more important. So we shouldn't generalize. So do a personalized evidence-based approach to the couple, and we have to have a right approach. Don't give up, have the right perseverance. Believe me, with each embryo transfer, the cumulative pregnancy rate goes up. And with the right techniques and right approach, our story can end in a positive note.